I'm going to be your student nurse today. I'm just going to close this curtain a little bit to give you a little bit of privacy. Before we get started with anything, can we just confirm your first and last name and date of birth? Okay, great. And I'm just going to double check your wristband, make sure it matches, and it does. And then for the purpose of this video, this is going to serve as my MAR. It's just like the case study that's on Canvas. And then do you have any allergies? Tylenol with codeine, okay. And that matches your wristband. And it matches what we have on the computer as well. So that's great. All right, so I'm in here today to be giving you some IV fluids. We're just giving you normal saline to help with any dehydration, and then that potential GI bleed that you have. You might have had some blood loss, so that can help replace fluid for that as well. And then we're going to be giving you some metronidazole, and that's going to help treat that H. pylori infection. Does that sound okay? Okay, great. And I double checked with the MAR that these medications that I have brought in with me are the medications that were prescribed. And then I made sure that it made sense to be giving you each of these based on your situation. When I grabbed the bags, I looked at them, made sure we're not seeing any weird discoloration, any punctures or anything like that. And then I also checked the expiration date on both, so they are both good to go. And then they are compatible, so we can put them through the same IV line. And then, are you feeling any pain right now? A little bit. Can you rank that 0 to 10, 10 being the worst, a 5? Okay. So do you think you need any pain medication? Not at the moment? Okay, great. So now I'm going to get started, but if you have any questions at all during the procedure, just let me know, okay? Okay, great. So I am going to start with this. I checked right person, right dose, right time, right medication, and right route. So this is our normal saline. I'm going to start by prepping my primary tubing. So I'm going to take it out of the container. Make sure we don't touch it on the floor. And then I'm going to take my bag, take the lid off, make sure not to touch the spikes so we aren't causing any infection. And then I can hang this bag on up. All right, and then we want to prime the tubing so that there's no air in the tubing, because we don't want any air to enter your veins. So I'm just going to hold this over our trash can and undo the clamp. Oop. First, I'm going to want to squeeze and fill up our drip chamber, and then I will undo our clamp, and hopefully, sometimes you gotta give the bag a big squeeze to get some fluid running through there. All right, it's going slowly. Okay, we're getting the fluid through. I'm gonna slowly. All right, we're gonna let all that air drain. Okay, and then when I see no more air in the line, I'm going to, there's a little bit of air. Make sure we get that all out. Okay, no more air in the line. I can clamp it, and then place our line in the machine. It's gonna beep at me. I close it. All right, and then I'm going to check the IV site, make sure I'm not seeing any redness, swelling, anything like that.
Of the list.
And then
6 o'clock open lab.
I will swab the area.
Should you go back out anyway? Okay.
Throw that away, and then I can attach it. All right, and now I'm going to get started. Select the channel, Guardrail IV fluids. We are looking for normal saline. I'm going to double check my MAR. That is correct. Yes, that's what we have in the bag. Our rate is 100 cc per hour, which is also equal to 100 milliliters per hour. We're gonna do 950 and start that, and then I can go ahead and unclamp it. And then we have our normal saline going. So next I'm going to get started on the secondary. This is your metronidazole. So I'm gonna take out the tubing, and then just like we did with the normal saline, I'm going to spike the bag, and then I can take this off, grab another alcohol swab, and swab this hub where we are going to connect it. Let that dry for about 15 seconds and attach it. And then we're going to hold this below the level of the primary, unclamp, and this is what we call back priming. So we are also getting all of the air out. We're gonna allow it to fill about halfway before we clamp it again. I can now hang our secondary, and to make sure that the secondary is the one that's going to be running, I'm going to lower the primary down. So now we are ready to set the secondary. Channel select, secondary, we're gonna be looking for metronidazole. Page down, here it is. We have the 500 milligrams per 100 milliliters. Yes, 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 it all matches. Next, I'm going to open my secondary clamp, and I can click start, confirm. Alrighty, and now it should be running. I'm gonna check and make sure I see 2 drops, 1, 2, so it is running. So now that is all set up, I can get started with cleaning up unless you have any questions. No? All right, here's your call light. If you need anything, you can just press that. All right, thank you so much.